It's my privilege and honor to serve you as president of the American Optometric Association now in one of the most historic times of this country and also in one of the more historic times of our profession. You have a chance here at this historic event today, this meeting that we've never had before, a very unique meeting of State Government Relations and Third Party Center to help set the direction of optometry in the future. You've just now witnessed the largest and the loudest and the most expensive public policy debate this country has ever seen, ever witnessed in its history. And it's no wonder it was so debated when you think about health care is approaching 20% of our U.S. economy. But also I think what we'll do when we look back in time, I think you will see back in time that the passage of U.S. health care reform will be a game changer. It's football season now. Some of you support professional teams, college teams. You look forward to the weekend when the football games are there. But when you get back after the game is over, you look back and you see there were certain plays in the game, certain events, certain turnovers that changed the momentum of that game. And I think that's what optometry will do in the future. When we look back, we'll see that healthcare reform in America was in fact a game changer for the U.S. healthcare system. As of March the 24th, which was the day after they passed healthcare reform, the #1 goal for the AOA became crystal clear. That goal was in fact to help our members thrive and succeed with the implementation of healthcare reform. I've been on this board since the year 2001. I've been a volunteer since the early 90s for optometry on the national level here. I've never seen the AOA staff and the AOA volunteers so engaged on this goal that you see before you here. It became very evident after the election of President Obama that the Obama administration, along with the congressional Democrats, were going to push forward with health care reform. Now, we're not so sure about health care reform, about where it was going to go, but we were sure about one thing. We were sure if we weren't at the table, we would surely be on the menu. As you can see here, we even went to the White House here. But for 5 years, you may or may not know, your AOA board set the course to have preparation 5 years ago about health care reform.